Alright, so this is take 2 of the physical exam video. I'm here with Scott. He's kindly agreed to let me perform a physical assessment on him. He's going to be beginning a new job in January, so he had to get a well checkup so he could begin work. So without further ado, let's get started. So when I'm first looking at Scott here, just at his general facial characteristics, I'm going to look for just the distribution of hair, the symmetry, any maybe periorbital edema or swelling that we might need to make note of. I'm going to be looking at his scalp, and he has a typical male pattern baldness that we see in a lot of older men. So when I'm looking at everything, I don't see any lumps or lesions on the top of his scalp that would cause me to be concerned. Do you feel any tenderness there, sir?
No.
Okay, so we want to start from the back to the front whenever we work our way that way. I'm going to start by palpating his maxillary sinuses, and he's going to tell me if he feels any pain.
None.
Okay. I'm going to palpate his frontal sinuses.
No.
No pain. Okay. And Scott doesn't have any abrasions or anything that would cause me to be concerned on his face. So we're going to, I lost my tongue blade here. There it is. Okay. So this is my makeshift otoscope. I'm going to start with the ears, looking at the internal structures, okay? So Scott, I'm going to look inside your ear here. Okay. Look at this here. And his tympanic membranes look that characteristic translucent pearly gray color. I don't see any clouding or any cerumen impaction. We're going to start by doing the Rene and Weber test. So Scott, I'm going to set this up here on your scalp, and I'm going to strike the base of it, and you're going to tell me, I'm going to move it to the outside of your ear here, and you're going to tell me whenever the sound disappears, okay? And then once that happens, I'm going to move it out front to the front of your ear, and that's going to test the air conduction hearing. So here we go.
I feel it. I don't hear it. Don't hear it anymore.
Okay. So that's good. Alright, I'm also going to do an assessment on Scott's eyes. I don't see any drooping the symmetry is adequate there. There's no ptosis or, like I said, no periorbital edema under his eyes. So I'm going to shine this pen light here, okay? I'm going to get you an index card here. Okay, right now we're going to test his visual acuity. He's going to be looking at the Snellen chart over here. So, can you hold that over your eye and then tell me what you read on line 4?
A, B, C, D, E.
Okay, now hold the other eye.
A, B, C, D, E.
Okay. Now we're going to be checking the 6 cardinal signs of gaze, the 6 cardinal fields of gaze, okay? So just follow my pen light. Don't move your head. Okay. That was good. So that's his extraocular movements are intact. Can you place one finger on your nostril there, sir? Okay, now breathe in. Okay, now do the other one. Is there any difficulties doing that? Do you notice any
No.
occlusions? Okay. So here we're going to be just testing his smell, his olfactory nerve. I got peppermint oil and I have orange oil. Okay, so what you're going to do is cover your one nostril. I'm not going to tell you what scent it is. I'm just going to put it under there and you tell me what it is, okay?
Peppermint.
Okay. Do the other one.
Peppermint.
Alright. So his olfactory nerve is intact. Now we're going to elicit the facial nerve. Can you smile for me? Okay, clench your teeth. Clench them. Okay, now bite down. Okay, that's the trigeminal nerve there. So bite again. Okay. I don't notice any popping or clicking, so that's good. Okay. Can you stick your tongue out for me? me shine my pen light in there. Okay, a little bit farther. Say ah.
Ah.
Okay. I'm gonna stick my tongue blade in there. Okay, I'm gonna just elicit your gag reflex, okay? There you go. Is that making you gag?
Mm-mm.
A little dry? Need a cup of water?
Yes, please. Thank you.
Can you move your tongue? Can you lift your tongue up for me? And just move it around. Okay, so his hypoglossal nerve is intact. Okay, the next thing we're gonna do is I'm going to palpate his thyroid cartilage and see if there's any nodules or masses that we need to be aware of. Can you sit on the edge of the bed here for me? Alright, I'm gonna give you this cup of water just to make swallowing a little bit easier, okay? I'm gonna stand behind you, is that okay?
It's fine.
Okay. Take a sip of water for me. One more time. Let me try this side now. Alright. Take a sip of water for me. Okay. I don't feel any nodules or anything. Is there any pain when I did that?
No.
Okay. Kim, come back this way for me. So now I'm going to make my way down his neck, but first I'm going to palpate some of his cervical lymph nodes and the submandibular and submental and the postauricular lymph nodes, and he's going to tell me if he feels any pain. I'm making my way down.
None.
Any pain there?
No.
How about there?
No.
And I don't notice any lymph nodal enlargement, so that's good. There's no pain, he says, so we're going to make our way down, and I'm gonna have you sit on this side again. And I'm gonna just listen to his lungs and check tactile fremitus. I'm gonna start from the posterior end though, just so I can hear it a little better on that side, okay? So what you're gonna do is I'm gonna make move my hands upward, and you're gonna tell me, and you're gonna say 99, okay? With each movement. Go ahead.
99. 99. 99. 99.
Okay. So now I'm just gonna listen to your lungs. Take a deep breath. Okay. Take your time. Deep breath. Deep breath. One more time. Okay, so I don't hear any adventitious sounds. His respirations are non-linear and regular, and it doesn't require much effort on his end. So right now I'm going to listen to your heart. Okay, so his heart sounds are good. There's no S3 or S4 hurt. I didn't hear any murmurs either, so that's good. Can I get you to lay down for me again, sir?
Back or
Yeah,
something?
on your back's fine. Alright, so now we're going to do the gastrointestinal assessment. As most of you know, we start with auscultating. We never palpate or percuss, just because that will elicit bowel sounds that would kind of affect the assessment purposes. So I'm just going to start out by listening, and I'm going to start out in the right lower quadrant. Okay, so Scott has normal active vowel sounds. I'll just hear some minor gurgling, which is normal and that's expected. I'm gonna start out by palpating and you're gonna tell me if you feel any pain, okay? There?
No.
Okay.
Okay.
How about there?
No pain. No pain.
Okay. Okay, so his bowel sounds are tympanic, which would lead me to believe that there's no fluid accumulation or anything in any of those organs. So the percussion tones were adequate for what we're looking for. Right now, I'm just gonna palpate his liver, see if we can get it to rise up underneath that costovertebral angle. Okay, so take a deep breath. That's good. You can breathe out. Couldn't really feel that one. So we'll try over here on the spleen. Any pain or tenderness with that?
None.
You mind if I look at the,
No.
just inspect your abdomen here? Okay. I'm gonna listen to his aorta just to see if I can hear any vascular tones that might be abnormal, any bruits. On some individuals, you will see a aortic pulsation, and that's normal. His abdomen is a little distended, but everything else looks great. I'm gonna take a look at his legs here. I'm seeing a little bit of abrasions. He said he was working in the yard, got bit by some fire ants. Scott, do you mind if I take your shoes off for a
No,
second?
I
Just
don't.
to look at check your pulses.
Sorry, my socks don't match.
That's okay. Got a good bounding pulse on both feet here. I don't notice any like venous stasis ulcers, and there's no edema in his legs. There's still pretty good equal distribution of hair. I'm gonna look at his radial pulses here and see how they are. Check his cap refill. It's good. It's less than 2 seconds. Can you squeeze my finger, sir? With this hand too. Okay. All right. Now let's get you to stand up on the side of the bed. Okay. Now, can you stand on one leg? Okay. Wanna try the other one? That's good. Alright. Now can I get you to face that way for me? And bend down. We're going to be looking at the curvature of his spine. Okay. That's good. That's good. Any pain with that, sir?
No.
Well, that pretty much concludes our assessment. I'm gonna go get the doctor. We're gonna go over the findings, and then we'll be back in here to speak with you
Thank
after
you.
that, sir.
Thank you.
You have a good day and good luck with that job.
Thank you.